Good evening and welcome to IHW Council's special web series on women's health. I'm Manisha Nair Dhawan and you're watching our exclusive show, The COVID-19 Fertility Dilemma. The ongoing pandemic has raised serious concerns among everyone, and women are certainly bearing the brunt of it. The impact of the virus on their pregnancy, their childbirth, family planning, and more regular and common concerns such as menstrual hygiene, nutrition, and mental health are among many of those issues that are bothering them. And then there is another issue that is causing immense suffering to many women, and that is the inability to conceive. Infertility over the years has emerged as one of the most common health issues that has been impacting young couples for quite some time. And according to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of India's population. And the scenario is worse in cities where one out of every six couples is impacted. Today's show is special as we are going to discuss every aspect related to infertility and how impacted women and couples can address this best during the pandemic. To guide us and to help answer all the questions that you may have, we are delighted to have with us Dr. Hrishikesh Pai, Medical Director, Bloom IVF, who is joining us now. Thank you so much, Dr. Pai, for joining us. Welcome to the show.
Thank you. Thank you, Amisha ji.
But before we begin the conversation, I would request all our viewers today to keep sending us your questions. You can type them in the comment box and we'll try to answer as many questions as we can in our session today. And do like and comment about your experiences. Do share this page with your friends. Put it on your wall so that those who may be suffering from this condition could find a solution, could find some information about how to solve this problem. Now, this show is, of course, supported by Bharat Serums and Vaccines Limited under its public awareness initiative. So let's begin, Dr. Pai. Every day we feel that perhaps there will be a turn in the COVID situation, but the number of cases in India are very high. For women who are seeking fertility treatments, should this be a scary point? Should they consider putting their treatment off? Because many of them don't really have that luxury. They may be old and the egg reserve may not be very good.
Yeah, so basically, when the COVID infection came in around March, we were a lot of associations all over the world who deal with infertility. They got together, and there was a general thought process that all the services should be stopped because infertility is not an emergency subject. So we felt that all the hospital facilities should be kept for non-infertile couples, means people who are in serious emergency, etc. And so we felt that the beds will be unnecessarily occupied. So on an average, almost the entire elective medical work all over the country was stopped in all fields, so not only infertility, cosmetic, this, that, hair transplant. And so then after 2 months, we started lifting the lockdown, and now there have been guidances, and we have also come to know there's been a lot of experience from China and Wuhan and all these, because the preliminary pregnancies were in China. So now we came to know that there is not much of transmission going into the pregnancy. There's not much transmission via the placenta. There's not so much in the semen. And so the guidance was to restart the services. So in the first phase of the guidance, we have started for emergency patients. So patients who have got very poor ovarian reserve, patients who have what is poor ovarian reserve? AMH, anti-Mullerian hormone, less than 1.5, or antler follicle count, that is small follicles in your ovary, if they are less than 7 in number. Okay, so this is, or your age is more than 35 years of age. So these are all indicators of poor ovarian reserve, and that your fertility status is slowly dwindling down. So you can't wait more. So these are the patients that were prioritized. Then there was I do a lot of cancer work also, means patients who are young, who are not married, or who are married but who don't want kids, and they have cancer. So before the cancer treatment starts, radiation therapy or the radiation or chemotherapy starts, automatically the ovary gets totally destroyed. So prior to that, you can freeze the oocytes or the ovaries. So I do a lot of that work last 10 years. And so those patients, recently I've frozen 3 patients, males also, with, they were going to go for chemo radiation therapy. So prior to the therapy, you freeze their semen sample. So these are the group of patients which we started doing since last 2 months. And
Okay.
we took a lot of special precautions, which I can tell you about in the next few minutes. But we also are now started getting the second part of the patient, that is the normal patient. And I will tell you and argue as to why they should also come for the treatment.
Okay. Tell us why should they come for the
So
treatment?
basically, what we have now, so what we did was because of the discussion all over the world, in fact, nearly 10% of units never stopped doing infertility treatment in the United States, though
Okay.
90% stopped. So, when I was in conversation, this is unofficial information. And so there was no governmental guidance. There was no government saying that you should stop. The government had listened to us, and overall, we know that the pregnancy is not dangerous, because otherwise government would have come with a directive that don't have children during this time.
Okay.
They didn't tell us. So even naturally you can have pregnancy. So there is not much of danger in having pregnancy by artificial methods as well, so long as you take precautions. So what we did initially, there was a difficulty in doing testing, but down the road, like 1 month back, I don't know the exact date, they opened up the testing in the country. They said anyone can go and do the testing. So that was a great boon, because now what we do is that we not only test our employees, so we have we wall off the unit, but we also test the couple. So at the start of the treatment, they are tested before they enter the cycle, and on the 9th day of the injection, they are again tested before the final injection is given, and we take the eggs out. So if at that point in time, if the test is positive, then we don't do the pickup. So we did about 100 couples in the last 2 months, and we have done testing. So we did totally 337 tests, and we got 6 patients positive. Out of that, 2 are couples. So, and in our Delhi unit, so we have units in the north in Delhi, Gurgaon, and Chandigarh, and we have units in Mumbai, Nasik, we have unit in Navi Mumbai, South Bombay. So we found that the prevalence rate in Mumbai is around 5%, while in Delhi is around 1.5%. And in Chandigarh, in the 70 patients we tested, none of them were positive.
Okay. So the infertile couples can go ahead with their treatments and not
So
put it
we
off any
took a lot
further.
of precautions. And so now at the same time, what has happened is we have to start working. We can't be in lockdown all the time, because this virus is
We don't know how long it's going to take.
It's going to infect till it goes and infects 70% of population. You are not going to have to see the end of this epidemic. And that is why I feel that in a way India is better, because the rate at which the infection is going up in India, we will finish first. Like United States, we will totally, like for example, you have New Zealand. They don't have, their population is totally virgin. Every time there is going to be an infection, they are going to have an outbreak. By the time in India, in the next 5 months, everyone will be positive. So in fact, we will get out of this whole pandemic faster than a lot of other countries. In the long run, it's like the race between the tortoise and the rabbit. So but the tortoise, that is India, will ultimately win the race.
All right. Dr. Pai, we started getting questions from our viewers. So we'll now take up a few questions. We've got a question from one of the Facebook users asking, how common is male fertility? What are the signs of infertility in men, and what are its causes?
So male infertility is very common. So if you have 10 couples who are infertile, nearly 40 to 50, means 4 to 5 of them are due to male factor. And it's very simple. We can just do a semen test after 3 days of abstinence, and we look at the 3 parameters of count. Semen count, if it is less than 15 million, or motility less than 40%, or morphology, means abnormal forms less than 4%. One of the 3, if there is abnormal, we call it a male factor infertility. And so this is so before, when the couple comes, because if the test is so simple, even before investigating the wife, we first investigate the husband. Husband is the culprit. In the olden days, when I started my practice 35 years back, I had this husband who had 2 wives. First he married, and then he didn't have children, so he divorced her. And he didn't divorce her. He married a second sister. And apparently, when they came to me and I did the test, he was the problem. He had 0 count. So it was not the 2 sisters who were marrying 2 women. Is not, but in those days it was not that aggressive. Now, if you can't marry 2 women, So,
Hmm.
there are many causes of male infertility. The commonest cause of male infertility is idiopathic. You don't know what's the cause, but sometimes there is a swelling of the vessels around the testis. It's called a varicocele, or
Hmm.
there may be infection in the system which takes the sperm out. So
Hmm.
epidoma orchitis may be there due to, in our country, common infection is tuberculosis, or there may be chromosomal disorder which results in testicular failure, like Klinefelter syndrome. So there are
Hmm.
certain, so we investigate the male, but on an average, most of the investigations come out to be normal, and the
Hmm.
count is idiopathic. It's just there. There's no reason for the low count. So in many of these patients, we give them medication. With medication, many of them have an increase in count. If that fails, then we go for the next step of IUI, and if that fails, we go for the next step of IVF-ICSI.
Okay. Dr. Pai, what causes male infertility? Can you do anything to ensure that, you're more fertile as a man?
Yeah, no. It's all in the, it's inherited. In many of the times, it is genetic, so you can't do anything. But there
Oh.
are preventive things also you can do. For example, I told you that if the patient is undergoing chemo radiation therapy, he's a young patient. He
Huh.
is going for chemo radiation therapy. He's not married, so you can collect his 2-3 samples and freeze them. So after
Okay.
chemo radiation therapy, even then afterwards, when he gets married, you can use a frozen sample and have a child. So this is,
Hmm.
so prevention is very important. So safe sex is very important. Infections, sexually transmitted diseases can cause male infertility. So it's important to, then, if you have mumps, the mumps can also damage the testes also, because it shares some common antigen. So the antibodies of the mumps virus can hit the testes as well. Then you have the varicocele. So, so all these things, so some of these causes are preventable.
Hmm.
One of the most important causes, preventable causes, is undescended testes. So at
Hmm.
birth, the testes are normally in the abdomen, in the tummy,
Hmm. Hmm.
in your mother's womb. As at birth, the testes come down. If the testes fail to come down, that is called undescended testes. That
Hmm.
can damage the testes. So, at birth, you must check for testes, whether they are in location or not. If the testes are
Okay.
not in location, you can pull the testes down by a surgical
Hmm.
method. So in
Okay.
the olden days, people used to miss this out. Now, because when I see them 25-year-old, 30-year-old
Hmm.
patient coming to me, अरे सर वो टाइम समझा ही नहीं कि टेस्टिस ऊपर था, पुल नहीं किया मैंने, हमारे
Hmm.
पिताजी को नहीं मालूम था. So these are, now we are more advanced, and
Hmm.
automatically all the male babies are examined at birth to see whether the testis is in right location or not.
Or not. Okay. Another question that has come in is infertility a male or a female problem? I mean,
Right. So no,
can
no.
you
So
give us
it's
the
as I
percentages?
told you,
Hmm.
40% are due to male, 40% are due to female problems, and 10% are due to both having a problem, and 10% we can't find a problem, and that is
Okay.
known as unexplained infertility. So
Okay.
this 40, 40, 10, 10. 40
Okay.
male, 40 female, 10 both of them, and 10 unexplained.
All right. Dr. Pai, we've got a question from a Facebook user. The question is, I came to know that remdesivir use in COVID-19 is contradicted with pregnancy. Can one take it? And how can we determine the dosage if one is pregnant? Is it contradicted for pregnant women?
I'm sorry, I can't, because I don't deal with the pregnant with, I deal with the
Okay.
first 3 months of pregnancy. I don't deal with the
Okay.
next pregnancy. But so I would not like to, but I can tell him the answer by tomorrow, 24 hours. I'll find out and tell you the answer.
Okay. So you spoke about male infertility, Dr. Pai, and you said that it can be worked on. But in case of hereditary or genetic issues, can it be treated? Like, what is the percentage of male infertility that can be treated by medicines, by procedures, either corrective ones or even the ART procedures?
So
Um,
some of the male infertility, like husband is a Klinefelter syndrome, and there is some of them do have sperms in their testes. So in
hmm,
these patients, you can do, because the Klinefelter syndrome, there's an extra chromosome XXY. So this can be transmitted to the child also. So if you are doing IVF, we do IVF, and after we do IVF, we can take the biopsy of the embryo, do the analysis of the embryo, and then we can do pre-implantation genetic diagnosis and transfer the embryo back. Hello.
Dr. Pai, you can
Yeah,
continue with your
I
sorry.
can Himani,
Yes, sir.
I think Anisha, huh? So I can keep on talking in case the audience
Yes,
is
yes,
there.
sir.
So primarily, so what we do is we can take the egg out, take the sperm, we inject it, make the embryo, and before we put the embryo in, we can do embryo biopsy. We can do analysis of the embryo by genetic testing, and after that, the normal embryos can be put in. So there's already in azoospermia patients, especially in the United States, there's a common disorder called cystic fibrosis that can also be inherited. Especially if in cystic fibrosis, these patients have no sperm as well. So in them also we can do pre-implantation genetic testing, and after the testing is done we can then put the normal embryos back. So if there is a, can I continue, Himani?
Yes, yes, sir.
So if there is a male infertility, normally we would look for any problems in the male, and if there is any problem, we can correct it. If there is a undescended testis, we can treat it at birth. If there is a varicocele, swollen vessels, we can, do surgery and ligate them. Nowadays, you can do even laparoscopic ligation of the varicocele without, cutting the skin up. And if there's a blockage, we can, try to do microsurgical anastomosis and overcome the blockage. All that we can do. And if suppose there is a low count and we do medicine and we treat them with medication and they still don't improve, then we can do IUI. So what is the IUI? We give medicine to the lady, and we do the create few over eggs, and we monitor the on ultrasound. And when the eggs are mature, we can ovulate them. At that time, we take the sample of the husband, wash it with a special technique, and the best quality sperms are then put into the uterus. It's a very simple 5-minute procedure. It's called intrauterine insemination or IUI, and the pregnancy rate is around 10-15%. So if 10 people undergo IUI, every time one or two will become pregnant. So we can do 3-4 IUI cycles, and many people will become pregnant with IUI. If that fails, then we can go to the next step, like how in cardiac problem. If there's a patient with cardiac problem, first we'll do a stress test, we'll give medicine. If that fails, we'll do an angiography. If there's a block, we'll do an angioplasty. And if that fails, we'll do a cardiac bypass. So similarly, if IUI fails, then we can go for the next step, and that is known as ICSI, intracytoplasmic sperm injection, which is a form of IVF. So that's what we
Right.
do.
So, sir, our next question from the audience is, what is unexplained infertility?
So see, what happens is that when a person couple comes to us, we first check whether there's a problem in the father or the mother. So in the father, we do a simple semen test. I told you that 3 parameters we look for: count, whether count is normal or not, whether motility is normal. Motility is movement of the sperm is called motility, or morphology means how the sperm appears. So if they are all normal, we know that there is no male factor infertility. There is no problem in the husband. Then we look at the female. So in the lady, we do hormone test, we do test for ovulation, and after that we do sonography of the pelvis, see if there's any big tumor like a fibroid, or if there's a big swelling in the ovary. It's called an endometrioma, or there's a PCOD. So we look for all these things, and if there's an abnormality, we'll treat. Then we test for tubes, whether the tubes are open or not. So normally we do a simple test called the X-ray of the womb. It's called hysterosalpingography. So HHG is done. And if the tubes are open, nowadays a new test is done, because HHG is done. So there's a radiation exposure. You have to
Right.
take X-ray. So instead of that, we do a new test. It is called HICO-C. So it is done with ultrasound machine, and ultrasound is more safer than X-ray. So by these two tests, you can make out whether the tubes are patent. If the tubes are patent, then we'll do 2-3 IUI cycles. Many people will become pregnant in the IUI. However, if they don't become pregnant, we put a laparoscope inside the tummy. So there's a small uh, telescope which we put after anesthesia through the navel into the tummy to see if there is any problem inside the tummy, whether the uterus is problem, if there's an endometriosis, is there infection, adhesion. In our country, the most common problem is tuberculosis. So we rule out by putting a laparoscope, and at the same time we put a small telescope from inside the vagina into the uterus. It is called hysteroscope. So we see the cavity. If there's a small tumor like a polyp and all, we remove it. If there are adhesions, we cut it. So we do a diagnostic SOS operatives, laparoscopy and hysteroscopy at the same setting. But in many of these things, when you do an ultrasound, we do hormone test, we do HSG, we do laparoscopy, we do cement test, everything is normal. Those patients are called unexplained infertility. So all the tests in the husband and female and male are all normal, and despite of that they are not becoming pregnant. That is called unexplained infertility. So, but the treatment is for all is the same. You do the semen test. If there's a problem, treat the semen count, increase the count by medication or surgery. If there's a varicocele, correct the surgery. For women, do hormone test. If there's a thyroid problem, correct it. If there's a prolactin is increased, correct that. If there's a PCOD, treat it. Look for the tubes. If they are do an X-ray. If they are open, try IUI 3 cycles. If they are closed, go directly for a laparoscopy. After that, you try again for 2. So within a year's time, 90% of patients become pregnant with simple treatment after laparoscopy medication. Only 10% don't become pregnant. Those are then given the treatment of IVF.
Okay. So, you mean to say that IVF is also a treatment for unexplained infertility?
Yeah, if in everything else fails. So, in an unexplained infertility, we'll do a laparoscopy. If there is mild endometriosis, we'll burn it. If there is some adhesion, we'll correct it by cutting it. If there is a small endometriosis which we have missed, we'll correct it. We'll put a hysteroscope. If there is any small, tiny polyp, we'll remove it. After that, we'll do 2-3 IUI cycles. Is that many people will become pregnant. If they still don't become pregnant, then for them also the treatment is IVF. So IVF is the ultimate treatment. So, but for 90% of patients will become pregnant without IVF, and this is what we have to tell all our patients. Every time a new patient phone me, sir, I want to do IVF. What are your charges of IVF? Baba, I said, have you done things normally? Have you done your test? No, I have not done. I just want to know what are the charges of IVF. I said, Baba, this is only for 10% of people. 90% of people become pregnant with non-IVF method. That's why I'm about to launch tomorrow a new website. It is called gentlefertility.com. My new website is called Gentle Fertility. Gentle, soft, no worries. 90% of you will become pregnant by non-IVF methods. Take it softly. Don't be panicky. Relax. De-stress yourself. Improve your lifestyle. And you will become pregnant on your own. And then if you don't become pregnant, Uncle Pai is always there for you.
Right, sir.
Or you can call me Grandpa Pai now. Whatever. It depends on, age is in the eyes of the beholder. How you look at me, some people say, Dr. Pai, you are too young. And some people say, Dr. Pai, you are too old. So that's for you to decide.
Right. So our next question, I guess you have almost answered. The next question was, can all infertility be treated, and what are the treatment options available of infertility in India?
So basically, I started doing IVF in when I actually I was fortunate enough because Dr. Indira Hinduja, who was the first to do IVF in India in KM hospital, I was her houseman when she was doing her experiments and all, when we were all very inspired by her, what is she doing and all, in KM. And when we had the first baby born in KM, we were all very excited. I remember we had a big party in our house also. We had a great party in our house. So since then, I was inspired, because you are inspired always by your bosses. So I have been doing IVF. I went to Australia and I started IVF in 1990. We were only 10 of us that time. In 1990, we were doing IVF. Now there are 3,000. And every day, I think there are 2 IVF units opening. So those were the great days when new things were there. And last 20 years has been a fantastic, 30 years has been a fantastic journey of IVF. New technologies have come up. Now, we have the latest technologies of artificial intelligence. We have non-invasive pre-implantation genetic testing. So I always feel that Okay, now everything is over, but there's so much. Do you know that the latest breakthrough that has come in, and it is going to be, it's been coined as IVG, in vitro. I forget the name of but in Japan, they have taken the skin cell and reversed it. So you can reverse a skin cell, make it a stem cell again. So you can reverse the skin cell. Normally, a stem cell becomes a skin cell. You, by injecting in the skin cell certain factors, they have reversed the skin cell and then made a egg out of the skin cell and injected with the sperm and made a baby mice. Their baby mice have been born already. Imagine. So at 10 years from now, we'll be able to remove the skin and make the eggs from the skin cell, make the sperms from the skin cell. Suppose two women want to have a child, also can happen. Or two men, they have to take the skin cell, reverse it. One of them has to make it into an egg cell, one has to make it into a sperm cell. So these are breakthroughs that are there, which are going to come in. And also, now we are doing testing of the embryo. So in the future, you will be able to test. So one of the biggest problem at present is the number of eggs is limited.
Yes.
Okay, so now with the skin cell, you can produce 1,000 eggs, and then you can get 1,000 embryos. Then you can automatically test the embryos for diabetes. Whole Indian population is diabetic, hypertensive. You can, and now in the future, you can even correct the embryos with the new technology of CRISPR. So, okay, you will be able to test the embryo, and if it is a diabetic embryo, you can correct the diabetic gene. Nowadays, what we do, if there's an abnormal embryo, we throw it away. Can you imagine throwing away an embryo? So in the future, 10 years, 20 years after ICMR allows us to do all these things, we'll be able to do all these revolutionary things.
It sounds very exciting, Dr. Pai. It's like nearly playing God if you can even pick what kind of child you'll have without X disease or Y disease.
People. We will not allow the technology. See, the point is that people always get scared that technology will be misused, but we should control it. Why look at the negative? We should always look at positive. Technology can be used for the right direction, and we will not allow people to use it for the wrong things. We will not allow people to use it for eye color. We will not allow. Already in our country, it is banned. We cannot allow sex selection in our country.
Yes.
They put in jail for, and not only you, doctor, but the patient also in jail. So, a country can legislate and control what it wants.
But we should adopt the technologies as they come in and monitor the way it is used.
Right.
We're getting more questions coming in, Dr. Pai. And the next question is, what are the key factors that cause infertility? Again, if you could break it down in percentage, is it a lifestyle issue? Is it a genetic issue? Is there something else? What causes infertility?
No, there is definitely a huge amount of lifestyle issue. For example, during this COVID epidemic, a lot of people have become pregnant. There was an article from Pune Times of India where they said that out of 9 patients became pregnant on their own who were waiting for IVF. So I phoned, she was my colleague, and I said, what are you talking? Means your patient selection was not accurate or what? But yes, there is a lot of people who, it's a stress which is causing them the infertility. And if you de-stress them, in fact, a lot of clinics are there worldwide now who I would not say peddle, but who project themselves as non-IVF clinics. So you can go there, they will give you lifestyle medication, they'll give you weight loss, they'll give you meditation, they'll give you supplements, and they achieve a lot of patients. They become they give acupressure, and the patient become pregnant without medication. You understand? But what I believe in a holistic approach to life. When, for example, for me, Ayurveda is also very important. Homeopathy is also very important. Unani is important. Allopathic is important. Each one has its importance, and we should all do the best for the patient. So I don't look at other fields adversarially. Suppose there is a lifestyle clinic who believes that lifestyle is important. Yes, I believe that lifestyle will make a difference. In fact, just before I came to this thing, I had attended a session of Sri Ravi Kumar's
Art of Living.
What is it called?
Art of Living?
Art of Living. So I attended 4 sessions of Art of Living. Just someone phoned me and said, Hrishikesh, why don't you just attend this session? So 10 days back I attended it, and I really liked it. Meditation, breathing and all. So I just was telling my assistant that all our patients, I will pay for them. They should attend that course. It's nothing to do with religion.
Okay.
Nothing to do with religion. It's just a lifestyle course. Meditation, breathing, looking positively
You're
into life.
saying that an improved lifestyle can increase fertility outcomes.
Obviously, very much.
All
And
right.
but there is the extreme viewpoint that we don't need to do any treatment. आपको lifestyle से ही बच्चा हो जाएगा. That is also not correct. It's a
Okay.
complementary kind of treatment. The
Hmm.
together. See, our problem is that we are India में there are extremists, or in the world they have a particular stand. I think that the stand should be not there. We should look at everything in a more gray. There's nothing black and white. Everything is a gray. It's a gray zone, and that is
Right.
important. I think I personally feel gray is always better.
We've got a question, Dr. Pai. How far is genetic responsible for infertility in males and females? Out of all the infertility cases you see, how much do you attribute to lifestyle problems? How much do you attribute to genetic issues? And how much do you attribute to unexplained?
Yeah, so as the age advances, genetics starts playing a very big role. So,
Okay.
suppose there are a woman less than 35 with 10 embryos. Out of the 10 embryos, 5 will be normal and 5 will be abnormal. But as the
Okay.
age advances, suppose she's 39 years old, out of 10 embryos, 1 or 2 will be normal and 8 will be abnormal. So nowadays, abroad, and now even with us, we have this technology which is known as pre-implantation genetic testing. So if the patient is more than 35, we offer it to them. So before we put the embryo back, we can take the biopsy of the embryo and we can do genetic testing of the embryo. It's known as PGTA, pre-implantation genetic testing for aneuploidy screening. And there's a new breakthrough in genetics which is called next-gen sequencing. So you can do the whole DNA sequencing using an NGS machine. I'm a crazy person. I love equipment. I bought this equipment last year and installed it, and we are now do next gen sequencing on our embryos, and we can detect abnormal embryos, and the normal embryos we put back in. And the new advancement in this is that without touching. Now, initially we used to take a biopsy of the embryo and we used to do analysis. Now the DNA also leaks around the culture media in where the embryo is growing. So without touching the embryo, you can take the culture media and you can amplify this DNA using a fantastic breakthrough technology from Stanford University. It is called ALBAC technology, which I have. And so without touching the embryo, I can amplify the DNA and then using NGS, next gen sequencing, analyze the embryo and put the normal embryo back. But this technology can also be used for other things. It is known as many people suffer from autosomal recessive and dominant disorders, which are like the commonest autosomal is a thalassemia in our country, but sickle cell anemia, muscular dystrophies, Fragile X syndrome. So these can also be tested. So you can create the IVF, take the embryo, take a biopsy, test is for whether it is carrying the disorder, and the normal embryos you can put back inside. And especially for thalassemia patient, I want to tell you that it's an exciting breakthrough that not only that you can, suppose you have a thalassemia major child, it's a very traumatic thing. You have to do blood transfusion on the
Many
patient.
times, yes.
You can do another IVF. You can select the embryo, match the bone marrow, HLA match with the first child, have the second baby and use the bone marrow of the second child to save the first child. So HLA matching can be done. And if there are people who are unaffording, I will do it for them at a very low cost. I'm telling you. For me, this is a very important, passionate part of, I want to help thalassemia major. It's a major trauma to the couple. So the genetic problem and selecting the genetic disorders, because now initially patient used to become pregnant and there was a genetic abnormality used to abort. Now, before you put the baby in, you can test the child and then put the normal. But
so
what is
Dr.
the most
Pai,
important thing in India? Sex selection for
will
male
not be done.
is illegal. You will go to jail for 10 years, doctor and patient. So for that,
so Dr. Pai, you said that
ask me, I'll put you to jail.
So Dr. Pai, you said that one is you take a biopsy of the embryo and test for any genetic or chromosomal abnormality, and the other is you test the DNA from the culture. Now, when you're taking a biopsy, what is the risk to the embryo? You take a biopsy, you find the embryo is fine. You implant it into the mother, but is this safe? Because traditionally, this is not thought to be safe.
Technology has changed. So in the olden days, when the embryo was day 3, when it was 8-cell embryo, you used to go and take 2 cells out. So it was known as blastomer biopsy. So, but there are 2 of the cells of the 8 were, but nothing else to happen, but we don't know. But now what we do is in a blastocyst. So on the day 5, the blastocyst becomes a 150 cell embryo, and there's an inner cell mass from which the baby is born, and there's an outer trophectoderm shell from where the placenta is made. So you take the biopsy from the trophectoderm and analyze it. And so you don't touch the inner cell mass from which the baby is going to be born.
So the risk is less.
So risk is not there.
Okay, and in the DNA culture one, there is no risk at all.
But non-invasive test is better.
Which
However,
is the DNA
not
culture.
as accurate as at present. It is not as accurate as the biopsy test. It is 80% concordant. Means 80% it is accurate. It is being refined. But many people so if you have a single gene disorder like thalassemia, you have to do biopsy. There is no way out for you. But if you are doing it for improving a pregnancy rate, you are more than 35 years old, you have had recurrent miscarriages, you have had more than 2 IVF failures, then in those patients, you can use it to grade the embryo. So in which case, you can do a slightly less inaccurate test like non-invasive testing.
Okay.
And I would be happy to tell you that my first baby of non-invasive testing was born last week. It is
congratulations.
I'm always passionate about bringing technology into India. Of course, after that, it gets replicated. But then we go to the next thing. So in my mind already is the thing of trying to get the eggs out of the skin cells. I'm going to apply for the ICMR permission to do mice work and start the work. See, the biggest problem which has been there in India is that we are lagging behind. Now we have actually caught up in animal experiments. We are lagging behind. Japanese, Chinese are very forward in research and development. But now we are, initially the 30-70 years we were busy trying to make a living. Now we are stabilized and now we can also compete with them in research.
That's very good. Dr. Pai, we have another question. Could irregular menstruation be a sign of infertility? Is it true?
So yeah, indirectly, because irregular menstruation, which means when you start aging more than 35, your hormones start becoming, your ovarian reserve goes down, and then you can start having irregular. But you can have irregular menstruation in a PCOS patient as well. So in young PCOS patient with a huge amount of egg reserve can also have an irregular menstruation. So in both but I forgot to tell you that one of the abnormalities in low ovarian reserve is Fragile X syndrome. So nearly 5% of Fragile X syndrome will manifest as low ovarian reserve, and Fragile X is a major, so they are mentally retarded. So see, the philosophy of the future is you are going to have only one kid. You can't allow the kid to have an abnormality. So the new philosophy, there is this next gen sequencing. You can take the blood of the mother and father and do what is known as expanded carrier screening. So you want to get married, arranged marriage also. You can then do the testing of both husband and wife. We can at present we can test for 200 to 3,000 genes. The commonest are thalassemia, muscular dystrophy, sickle cell, fragile. But there are 3,000 genes, different, which manifest a different syndrome. So you test both husband and wife. If there is a problem, you pick up a gene which can cause a problem in the child. Then when the baby is, you either offer them pre-implantation genetic diagnosis. So you can do IVF for these people and test the embryo and put the normal embryo back. Or you can, once they become pregnant, you can test it and see whether they are carrying that genetic disorder. Because till now what is happening, patients have suddenly one fine day in the family, one mentally retarded child is born. Then they, now they go for the next child and then they do all the tests. We want to see that the first child is not born mentally retarded. And this, now with the new NGS which is come in our hand, now the expanded carrier screening costs about 40,000 for the couple. But in 5 years time, in India, you know now how technology is there. In 5 years time, it costs 400 rupees.
Right. But Dr. Pai, you would recommend this to somebody who has a known genetic problem, right? From mother's side.
Carrier screening is for now people who want to have a child in the future. No known genetic. That is the thing. Na? Once you have a known genetic disorder, you are totally finished for life. Once you have a first baby born, Fragile X, you are doomed. Not doomed means, of course, you love the child, you take care of it, but your whole life, husband, wife will be focused on the child. Everything will change for you. You have to see that. So if you have the ability, if you at present in India, it's the people like us who have the ability to test, we should test. Later on, then as our country progresses and our great Prime Minister has already done the Pradhan Mantri scheme, Rajiv Gandhi, I mean, what is that?
Ayushman
Ayushman
Bharat.
Bharat scheme is there. And as he expands the scheme and gives it to everyone, then all of us, all the rich and the poor can take care. It's a matter of amplification. More the machines of NGS, lesser is the cost. More the testing, more the accuracy. You know, in our country, nearly 6 million sickle cell and thalassemia patients are there in the region of Madhya Pradesh, Chhattisgarh, and all these areas. These need to be tackled. It's a very important. Mr. Modi's done so much of support for IGIB. There's a big institute in Delhi called IGIB Institute, where a lot of work on thalassemia is going on. But that is for people who are already born. We have to prevent thalassemia. We have to prevent sickle cell anemia. That is the challenge.
Dr. Pai, would you say that infertility is becoming more common? And I mean, the way you're talking about technology and how it is being useful, do you think it will become uncommon going ahead? Or do you think it is common now?
It is common, not because of anything else, but because our lifestyle is changing. So I would like to tell you that one of the countries with the highest number of infertility clinics is Japan. Because most women in Japan, they get married at 44, 45. पहले शादी नहीं करते हैं, तो when by the time they get married, they have to go for IVF. So see, now women in India are enhanced. In fact, women are better than men in all. They are more disciplined, they are more smart, intelligent, hardworking. I don't know. हमारा कुछ तो defect है male or Indian male में, but Indian women are more smart than the Indian male, so they are equally competing with everyone. So they don't want to have a kid. So one of the ways is, so that's why as they postpone it, naturally their biological clock starts giving them
taking away. Yeah.
So one of the things is you have to freeze your oocytes at a younger age. So at 30, you must freeze your oocytes. If you are an aggressive, competitive person, and again, they don't want to compromise. Why they want to get married to someone they don't?
No, that is okay, Dr. Pai. But if freezing your eggs is a common practice, it's cheaper. If there is no stigma attached to getting ART done, then many women would go for it, don't you think?
So if you look Facebook and all that are already freezing, and I have been freezing for last 10 years. 2007 I started freezing. I went to Tokyo to get trained. As I told you, that Tokyo is where all the women are more than 45 who get married. So I got the training, and then I've been a pioneer in this freezing process. And though I never pushed it too much, the freezing. I was reading an article in Wall Street Journal, and they had interviewed a lot of women who had frozen their eggs 10 years back. Majority of them, they naturally conceived. It's just it's a comfort zone. Okay, I have frozen my fertility. Not that many of them may use the egg.
Okay.
But it's just, okay, I have done it. I am assured. I am not feeling guilty about, I'm giving more preference to my career and not my family. It's not fair. So that guilt complex is overruled more than anything else.
All right. Dr. Pai, thank you so much for joining us. It's so interesting and so insightful to speak to you. We've learned so much about the new technologies, and many of the women who have heard you today will get so much comfort knowing that technology can help solve many of their problems. Thank you so much for joining us and answering all the questions that you have answered. If any of our viewers have more questions, you can send them to us on WhatsApp. You can type into the comment box and send us your questions. We have experts coming in to help answer all your questions. Thank you so much, Dr. Pai, for joining us on this session today. Don't forget to follow us to stay updated on all the concerns that you may have on your health and well-being. We do many sessions to help you find answers to these questions that you may have. This program was supported by Bharat Serums and Vaccines Limited under its public awareness initiative. We will be back with another special show on women's healthcare next Friday on 28th August at 5 p.m. with Dr. Prakash Tiwari. Make sure you tune in. Make sure you follow us on Facebook. And if you have friends who are having any challenge when it comes to getting pregnant or carrying a baby to term, do ask them to follow our page and follow the updates that we have. Keep sending us your questions. We'll try to include them in the next show. Till then, stay at home, stay healthy, sleep well, and keep giving your mind and body a dose of positive thinking. Goodbye.
Thank you, Anisha. Thank you, Imani, and the IHW Council and Bharat Serum for allowing me to present my views. Thank you.
Thank